Today at Higher Learning, last March, Congress passed a bill that will allow young people to be covered under their insurance up to the age of 26. But it also highlighted the limitations of certain college health care plans, which prohibited students from using their parents' insurance and forces them into expensive plans. Unfortunately, another health care problem again, and here to talk about this is Peter Kerwin from the Rhode Island Higher Education Assistance Authority. Good morning, Peter.
Morning, Ben. How are you?
First off, do colleges even have to comply with this?
Well, they do, but the problem is the health reform bill didn't really take on this issue directly. I mean, as you said, it did create that provision where young people under the age from up to the age of 26 will get covered by their parents' health insurance, and that's great now in this job market where people are having a hard time finding jobs. The problem is that a number of schools have policies where they tell their college students that we don't want your insurance here, you can't use it, you have to buy our insurance. The problem is the insurance being offered by a lot of these colleges is much more expensive, provides a lot less coverage than the kid's parents' insurance would.
What's going to be done to fix this? Because, I mean, it's yet another...
Well, it's another big issue. I mean, Andrew Cuomo, the Attorney General of New York, took on the colleges a few years ago going after some of the lending practices, and now he's shining a light on this issue. And what might happen is there might be a few lawsuits coming out of his investigations. And Business Week magazine, just about a month or so ago, did a study of these college health insurance plans and found that for most insurance plans, you want a medical loss ratio of about 80%. That's the amount of premium dollars that are going into actual services and not, say, profits for the insurer or for administration. These health plans offered by colleges, their medical loss ratios are much lower than that, sometimes as low as 10%.
Wow.
So that really needs to be fixed. And what's going to happen, I think, is as the federal health care reform bill starts taking effect, some of these provisions are going to be taking effect as late as 2014, but as they start going into effect, there's going to be pressure on the colleges to fix their plans.
Do we see any possible changes in the quick future?
Well, what's going to start happening right away is that states are going to start coming up with their own insurance exchanges, pools to cover the uninsured. As they do that, they're going to put provisions in that require the colleges and universities to improve their level of coverage, improve the level of service, and improve those medical loss ratios. So that's going to force them to take action. That, together with the possibility of lawsuits, I think is going to require them to go and look and say, look, we've got to make our plans more transparent. We've got to be about offering quality service to students and not making money off of these insurance plans.
This isn't a state-to-state issue either. This is just, it's going to be one national thing and that's it.
Right, exactly. It's all over the place. Although the individual states will be coming up with their own insurance exchanges and may have tighter rules than other states, let's say. But it really is going to force the colleges to take some action to improve their plans and deliver better service to students.
Is there advice for parents and kids to, I mean, is there any way they can stay on the
Well, one of the things they can do is make sure you understand going in what the rules are that the colleges are going to impose. You know, if you're looking and trying to decide between colleges, even at this late point, take a look at what they offer for health insurance. Do they allow you to bring your own insurance? If they do, that may be a deciding factor.
Stay in school a little longer, maybe?
Oh, well, that's always an option, right?
Is there any good news out of this at all?
Well, I mean, it's just that I think the health insurance reform bill does kind of force some action on this gradually. It didn't take the issue on directly, but indirectly it's going to force some change in this, I think. So that's a good thing.
I heard something on the radio really quickly. You guys are doing something with the Paw Sox? The
we are. We've got
us a little plug for that.
Yeah, great. We're going to have booths there on Friday and Saturday. Saturday is 529 Day nationally. Yeah. So as part of that celebration, we're going to have booths there where you can come and kind of tell your story. What will you do to help your child reach college? And we're going to be offering prizes up to $1,000 starter account and some other tickets for the Paw Sox and some other things. So It's going to be a great event.
Getting involved locally.
Yeah, exactly.
Thanks so much. Peter Kerwin, good as always. Thanks so much, Peter. For more info on these healthcare plans for college students, just head over to the website foxprovidence.com.